Hi, my name is Dr. Christina Coock, and I'm going to talk about wellness and nutrition in this presentation. We are going to just go over overall wellness and nutrition and what the problem is and maybe what some of the solutions are in the United States and internationally. So one of the problems in healthcare is that 2/3 of all clinic visits result in a drug prescription. 2/3. So if you're going to go to a doctor, there's about a 75% chance that you're going to be written some kind of drug for something, whether it's a virus, an infection, blood pressure, heart, kidneys, liver, something. That's because we live in a healthcare system predominantly which is not focused on wellness and nutrition and diagnostics, but instead it's focused on what happens when someone gets sick. And that kind of seems odd, right? Like, why aren't we focusing on wellness and why aren't we focusing on nutrition? And it just has not been historically the focus. In some cultures, in the Asian countries, in the Middle East, it is more of a focus, but however, in the United States, it hasn't been. Kudos to those countries that are doing that and continue to do that because they're able to live a much healthier, productive life. Rather than just putting a Band-Aid on something, they are treating things from the day someone is born by giving them proper nutrition. And that's really where we should start. But the problem is that's not what's happening traditionally. There's a huge healthcare cost in this country because of the fact that patients are always in the hospital or in a clinic and they are prescribed drugs or they're prescribed a surgery as a result instead of just nutrition or wellness. And starting with that, not saying that the drug isn't needed, not saying the surgery isn't needed, but saying we've got to go back to wellness and nutrition so we can focus on that and keep people well and keep people better so that they aren't in that clinic and they don't have to have that drug, hopefully. 82% of the adults in the United States take at least one drug, and 29% of them take 5 or more. That's not saying that they shouldn't be on those drugs. That's saying that's pretty high. When you look at adults over the age of 70, it goes to around 14 drugs. So that means the more the body's breaking down, the more people are on drugs. It's better if you have patients or adults or people on products which keep them well, like nutraceutical products. That is a way that you can keep drug costs down. It's also a way you can keep people well. But right now, that's not the facts. These are the statistics. These statistics come from the CDC, as well as the FDA, and the government, and the New England Journal of Medicine. So they are actual statistics. As far as adverse drug events annually, they account for about 100,000 deaths. The fourth leading cause of death in the United States is prescription drugs. Prescription drugs account for 700,000 ED visits and 120,000 hospital visits, and that's direct, not indirect. When you look at indirect, it is in the millions. This is the indirect visits. And same with death. This is direct cause of drug events. We do not know the number that are indirectly related, but we think that it's in the millions. So, and that's pretty high to be the fourth cause of death, right, is prescription drugs, and that's one of the highest costs to our healthcare system is drugs. That's pretty impactful as well to hear. There's $3.5 billion spent on medical costs due to drugs. So remember, I was just discussing indirect costs, and that's what I mean. There's a lot of medical costs because of drugs that are not directly related to that drug. 10%, though, of prescription drugs now that the FDA labels are related to pharmacogenetic and issues with safety. So there's a lot of labeling going on right now that talks about the safety of the drug. And it's going to continue to get more and more because the FDA has become alerted to the fact that there are some pharmacogenetic and issues with safety with the drug. And when I talk about pharmacogenetics, what I mean is there's certain people that have genetics that cannot metabolize that drug. So let's say you're giving you're taking an antidepressant or you're taking something from your heart. The problem is if that drug, your genetics cannot metabolize, what that means is it will go into your system. It's not going to help you, or it might temporarily help you, but it's going to remain in your body unmetabolized and go to the liver or kidneys and sit there and cause liver or kidney problems and even sometimes failure. So what is the science behind our bodies and our DNA? What is that? So just so you guys know, everyone has a different genetic makeup. I'm sure you guys are aware of that. And we also have epigenetics. And what that means is we're born with the genetics, and then different epigenetics, which are underneath, can be unlocked. And that's why when we do cloning, you can clone an animal or a person, but that doesn't mean things are going to end up the same way. Because one person may be exposed to a toxin or be exposed to an environmental factor, which will cause an epigenetic to be unlocked, and they will develop cancer or multiple sclerosis or different things in their body, whereas the other individual may never unlock that epigenetic and may never have health problems. And that's because they are exposed to better nutrition, better minerals, better vitamins, and they are protecting their bodies. So that's something a lot of people don't know, and it's very important for us to know. Another thing that's very important for us to know is that medication impacts everyone's body differently. So I may receive a product for pain, and it might work. You might receive it, and your body doesn't metabolize it, and it doesn't work, and it can even cause death. Or that may happen with an antidepressant, or it may happen with like a statin is another one that causes a lot of issues. So you've got to be really careful that when your doctor prescribes a medication, it's able to be metabolized. Well, how do you know that? Well, there are different genetic tests now that will tell a doctor whether it's metabolized. And being metabolized is very different than a product being a patient being allergic to a drug. When you go to a pharmacy or you go to a doctor or you're having a surgery, they ask you, are there any drugs you're allergic to? They don't ask you, are there any drugs you're not metabolizing, because this technology was not out here until recently, and a lot of doctors are not aware of the fact that patients aren't metabolizing certain drugs and medication. But the truth is, we cannot metabolize all the medications. Our bodies are each different. So I've put on this slide different panels which talk about different classes of drugs, the drug name, the brand name, and then the pharmacogenetics of how it's metabolized in the body and the drug-to-drug interaction. It just shows you a lot of words, right? But I wanted to give you an idea of different panels that can be given that will show what happens with the patient when they take a drug. We also have different panels like this that can work with nutraceuticals, can show patients which nutraceuticals will work best in their body. One of the things I wanted to point out, because I did the presentation on the seeds, is the seed and the seed oil is naturally metabolized by sites. So it's a good solution to many of the drugs that are prescribed. Not to say that you shouldn't take the drugs. I'm not your doctor, and your doctor is the one that has to decide what you need to be on. But I am saying that when you take a seed oil, it's metabolized in the system, and it's not having the different issues. In fact, it's going in and it's adding protective properties instead of causing drug-to-drug interactions like some of your drugs can cause. Let's talk a little bit more about pharmacogenetics. I've studied this since I was in my 20s because of working at companies like Biogen and Alexion and UCB. We were in the biotech area, so we were studying genetics, and we were studying how to do monoclonal antibodies so they could go in and target certain genetics or certain cells to improve certain diseases and disease states. So what is the definition of pharmacogenetics? It's a science of how genetics impacts an individual's response to medication and nutraceuticals. That's one of the responses, and that's the definition I want to discuss today. So what is an example? An example of when things can go wrong. An example is 30 to 40% of opioids are not effective for pain relief due to individual genetics. They are solutions that are not synthetic-based products. That's what we've been talking about earlier, different solutions that can protect the body or help the body that are not synthetic-based. When you have a synthetic-based product, the body recognizes it as something different, and many times the body cannot metabolize it. And I gave you an example here of a pharmacodynamic pathway diagram for codeine, which shows you how codeine can remain inactive in its phase 2, and it's not metabolized. It's simply making the patient sick, which is why sometimes when people take morphine, they are nauseous, or they feel bloated, or they have GI problems. So a solution to that would be to try not to take an opioid and to take something that's naturopathic, a nutraceutical that helps your body. An organic option for patients are seed-based products and oil-based products because they go into the cell and they go through the cell wall and impermeate that area so it can treat people the most effective. Also, some of these products are natural food sources, so they're giving nutrients into the body that the body actually has to have to survive. So another thing I want to touch on that I don't have on this slide is 70% of all patients that go into a primary care doctor are on some kind of antidepressant or anti-anxiety medication. So another positive to that would be by taking nutraceuticals or seeds that help the patient not have to be on an antidepressant or anti-anxiety medication, because the antidepressant and anti-anxiety medication often have many side effects that aren't metabolized effectively by the body. And that's why a lot of people that get mentally ill go to a doctor. The doctor takes a shot in the dark and prescribes a variety of medications, and they don't even know if they're going to work, and a lot of times they don't work. So I wanted to present a study. It's called the Dayton study. It's a retrospective study collaborated with the staff model HMO, which is a type of healthcare delivery system in this country. It has 96 patients were tested in this study for predicted optimal response for therapy for depression or anxiety. And when they compared the patients treated with the optimal response drug, nutraceutical, as predicted with the DNA test, patients treated with the medication versus patients treated with the medication that was not metabolized, they were found the patients that were not metabolized were at risk for ADE and also lack of efficacy. So I want to give some statistics on that. The ones that received the medication that was prescribed that were not metabolized had 69% more health visits. So the p-value was 0.005. 69% more health visits. 67% more general medical visits, which is a threefold increase in medical absence days for employer groups or for you, or for your children. So basically people that were treated with medication that was not metabolized, that was used for depression, had 3 times more absences, so 67% more. There was a 4 times increase in disability claims because the patients were not doing well, and there was $5,188 increase per person in annual health cost, which is huge. So not only are you seeing a major impact on the patient health, but also on their economic status in this country, and also you see a major impact on our health system overall. So really, when you prescribe a product, you're thinking this is going to keep someone better and you're going to help them. The problem is, if it's not metabolized, it's only causing increased problems and increased quality of, or decrease of quality of life for that person. So what is a population management predictive model precision medicine response? And what I meant by that is, how would we deliver medicine in this country and other countries where it would be better? How would we do that? Well, one of the solutions and recommendations that people are having, not just in this discussion today, but also within CMS, Medicaid, and Medicare, is we could shift toward a nutraceutical or nutritional personalized science approach and keep people well. Treat them where their bodies need treated, keep them well by giving them the ingredients, nutrients, minerals, vitamins they need. So we give them organic nutrition. That's very, very important. We produce products and give them products that are metabolized in the body system naturally, like seed products and oils. These go directly into the cell. They permeate it because they're part of our system, because they're natural, just like our bodies are meant to be natural, and they go into our system and they protect and they defend the body. So products that have been researched and proven to do this are based on the origin of our genetic profile, and those are, again, seed-based products or mineral-based, oil-based products. And those ingredients go in and they're metabolized because they're supposed to be in our bodies. They were made for us. They go back to our roots and our origin. And they produce a personalized nutrition for us because the seeds and the oils go in or metabolized personally for each of us when we take them. Now, are there certain individuals that are allergic to certain seeds and certain foods? Absolutely. In those situations, obviously, individuals cannot take those. There's an allergic reaction. It's not that the body's not metabolizing. The body is saying, my genetic makeup is allergic to it. So in those situations, individuals should not take that product. But in a typical situation, the body is taking those nutrients from the seed, from the oil, and they're going right into the cell, and they're protecting and they're supporting the body naturally. So again, let's get some more scientific solutions. A scientific solution would be an approach to science and wellness that changes and improves the body with naturopathic and organic means like seed-based products. One of the other solutions would be to produce proprietary condition-specific blends of seeds that can actually regenerate the cell of the body because of the nutritional and genetic effect. One of the ways to regenerate the cell is to detox the cell. So if you can detox your cell, get all the toxins that are in our environment out of the cell, and then put proper nutrients in it, you're actually regenerating that cell because you're getting that cell younger, better, free of any toxins, and then you're putting the appropriate nutrition into the cell so that your genetic makeup is working the best that it can. Another thing to do is to customize scientific formulations that improve over time and are proven by research, which is why I did the discussion on black cumin seed that has over 600 published research articles. Actually, it has thousands of them, but 600 that I really found that had a lot of data about patients and people. But again, there's a couple of thousands that are out there about the efficacy and safety of this product, as well as the other seeds that I discussed. Another solution for people is literature and scientific updates and insight that improve the standard of nutraceutical care over the years and over time, and that's what we're trying to provide to you guys. So we want to go directly to people and help them take control of their own life. Furthermore, we need to produce more sustainable ingredients and more sourcing and seed-based technology, and that means we need to get the best seeds there are, the healthiest seeds, because the healthier the seed, the healthier the nutrients that go into our body. So it's very important that we take these raw seed materials and we apply them and deliver them into the cell. And I put on this slide stem cell, and that's because your stem cells are basically your basic cells. And so to take a seed and oil, they're really going directly into that cell, and they're detoxing and regenerating and producing a better cell, which then, as we talked about earlier in the previous slide deck, will communicate with other cells. Instead of saying, you need to be sick and look like me, I have cancer, they'll say, you know what, you need to die if you have cancer, and you need to be healthy like me. And then you're producing a cascade of events in the body that the cells duplicate into healthy cells instead of sick cells. We need to produce more research, clinical, and scientific support for people and patients and doctors as well, so that they understand what they're putting in their bodies and how it affects their health. We need doctors to understand this so that they understand what they're prescribing and giving patients, and so that they can turn to a more holistic approach and keep people better. Another thing we need to do is we need to be regularly updated and have unbiased material that's produced and substantiated by literature. And that's one of the things that we're trying to do, to make sure that there's white papers, publications, and everything else that give people a basis of what they need to do in their body, and they give them the facts around the nutraceutical and supplemental nutraceutical medication or products that are put into their body. And that's done by doing different panels, and we're working on that as well. So today we're focusing a lot on solutions and the dedication to nutraceutical products and the sciences. So what we really want to do is we want and we need to produce research that's based on organic seed-based products and that supports people's needs, wants, and values. We need to do that by clean labeling, by production, and by manufacturing of those products. So we need to go to the source and do that the right way. We need the right seeds and the seed oil-based ingredients to make the right nutraceuticals. We need the right base function food and drinks so that people are not just taking vitamins, but they're also taking food and drinks that will have the best seeds and the seed oil in it. And sometimes that's the best way to deliver that product into the system. It's very important that we use organic and non-GMO nutritional foods, products, and supplements, so that we move towards that because it's healthier for the body. The low sugar nutrition is very important. So sugar is not bad, but sugar in large doses is. So we need to keep the sugar content down. Having things gluten-free will help with the anti-inflammatory effect, so we need to try to keep things gluten-free. Sorry, we also need to have things fermented. And what I mean by that is we need things to be in their best format, so when they're delivered into the system, it's focused on going and delivering into the right areas. And that's what we have with some of those seed-based products we have out there now. It's very good if things are vegan and vegetarian products because these are holistic and they're organic and they go back to our origins, and we know we're putting vegetarian and vegan-based products into our system, which is the best delivery into the body, and it causes the least work for the body, so it also helps with proper weight maintenance, etc. We need to make sure that the plant-based proteins and nutritional oils have a scientific profile that is used to improve health and support wellness and manage diseases. So protect, support, manage. We don't want to use products which can hurt the body, so we want to make sure the seed-based products that we put into our body are the right ones. Not everything is to be used in the body, and not everything is to be beneficial to each person in the body, so we want to select the right products. And that's why the products I talked about in the previous slide deck are very important. Those are very good products to be used in almost everyone's body. We also want things that will digest appropriately and metabolize, like I said, appropriately, so you have optimal functioning in your body. So to do this, another solution that we've come up with is we're going to do a customer-centered scientific outcome study and survey, and we're going to use outcome measures that were used with medication but with nutraceutical products, because we want to look at chronic pain patients. So any of you guys that are experiencing pain, we want to look at quality of life factors, so self-care, activities, pain, discomfort, anxiety, because we want to try to find out what people are experiencing and if these nutraceutical seed-based products are making them better. We also want to look at an interview score, which is called a Hamilton score, and that looks at anxiety, mood, tension, fear, insomnia, behavior, complaints, etc. in an interview. So we're going to be rolling these out so we can figure out what you guys are experiencing and how these products can help and are helping. So our scientific turnkey solution is to come up with a complete solution that implements wellness, science, and analytic capability into an existing healthcare and wellness for people so they understand how they're being treated, not just in the pharmaceutical and surgery space and in the clinic, but also in wellness, which is really giving people control of their life by giving them the right products that they can use. We want to use this to improve and revolutionize the personal wellness and healthcare space to become a true personalized medicine scientific advisory board. We also want to show the improvement of safety and efficacy through the science and research by documenting this with registries for the people that actually go through IRBs and the FDA so that we can produce this for the government and produce this for other countries. We want actionable items and data so that we can look at point of care for nutrition. And that means from the day someone's born, what happens if they have proper nutrition? And from the day someone goes into a clinic or the day they feel sick, what happens with that person if they have proper nutrition to support them? We want to provide tools to follow scientific necessity protocols and trial outcomes so we can prove this through data. And again, we want to incorporate personalized medicine for the people globally. Each culture, each genetic, each country is different, so we're going to be customizing this by developing key opinion leaders and by bringing in one doctor from each area, from each country, so that we can talk about what does personalized medicine mean for that country and for that group of people. We do not want to say, okay, what works for the United States works for the United States. We want to look at each category and each population. We want to develop pathways of care of wellness and nutrition, again, with these seeds-based products so we can go back to our native roots. We are going to be using some of the Indian health practices as well with this so that we can actually go back to some very organic and origin of where we are foundations for what we're doing on the science platform. So how do we do this? We're going to be developing an IT platform for our scientific advisory board where we do wellness and nutrition, and we're going to have portals where we give you an actual survey and you have an access to your portal card where we are looking at outcomes and we're asking you questions and we're giving you a report and a score, and we're also giving you access to what's called a medical advisory board where you can ask questions. So the scientific advisory board will be developing this so that you can ask questions of various medical professionals. They will have to answer in a certain way because you aren't their patients, but they are doctors, and we are developing this again so that we are picking a doctor in each country. We possibly will be bringing in some holistic doctors as well from the Indian health side, but we are working on this format right now so we can deliver to you the best format possible. So what is the value of doing this platform? The value of this is so that we can produce the science, clinical, and analytics surrounding seed oil-based technology so that you don't just hear it, you see it, it's factual, and we document it, and we produce it and publish it in societies, journals, and in your major educational formats. We don't want to just show a clipboard where you see marketing. We want to show you facts where you see a dashboard and you see how it's helping people, and you're able to see and track how it's helping yourself. We also want an analytic and wellness platform so that we can produce a proprietary platform which shows measurable nutritional dashboards, which no one's really done to the extent that it needs to be done, especially not in the United States or globally. So we will be bringing this into a global format as a science board and as a medical advisory board. We're going to produce clinical research customer tools, which will have surveys and platforms, as we discussed earlier, and we will be generating outcome protocols and pathways that are around the seeds and the oils and the products that we are finding produce healthier bodies. And doing this through a centered and continuum approach so that you guys have all the information needed at your fingertips. I know Obama's leaving, and I'm not choosing any kind of format, but I want to go back, or political side, but I want to go back and I want to state what he said in 2015 in the State of the Union address. He said the 21st century business will rely on American science, technology, research, and development. I want the country that eliminated polio and mapped the human genome to lead a new era of medicine, one that delivers the right treatment at the right time. In some patients with cystic fibrosis, this approach has reversed a disease once thought unstoppable. Tonight, I'm launching a new precision medicine initiative to bring us closer to curing diseases like cancer and diabetes, and to give all of us access to personalized information we need to keep ourselves and our families healthier. That is the intent of the Scientific Advisory Board and the Medical Advisory Board, and that is what we will be working on in 2017. Thank you. I look forward to talking to you guys soon. I hope you have a good day.